I'm your host, Lisa Mazuka. Today, I'm here with my guest, Trish Magnata from Monmouth Integrative Counseling Services in New Jersey. This podcast is brought to you by On Your Mark Designs. We're a digital marketing agency in Bayville, New Jersey. We're here to help you find the best businesses and services to help you shop Jersey Shore. Please stay tuned for a giveaway at the end of the show. We'll have you answer a question about something we talk about today, and we'll send the winner a gift card to Spire Coffee House before the next episode. Wherever you're watching or listening, please subscribe and follow the show. We air a new episode every week. Thank you for joining me, Trish.
Thank you so much for having me today, Lisa. It's an honor and a privilege to be working with you. So thank you so much.
Fantastic. So tell the audience, who are you? What is your business called? And what do you love about what you do?
We are Monmouth Integrative Counseling Services. We provide outpatient mental health to kiddos, adolescents, adults and older adults, as well as couples and families. We provide medication management services, and we are really trying to build an integrative model and approach to help people with mental health.
That's interesting. So tell us what you mean by an integrative approach to mental health.
By integrative, what we mean is an approach to mental health that encompasses mind, body, and soul. Oftentimes, people may assume that mental health simply means talking, which it can, or medication, which it can. However, at Monmouth Integrative Counseling Services, we believe there are so many other modalities that can incorporate improving mental health. For instance, right now, we are rolling out our second mindfulness yoga series, which is free yoga, sound bowls, and breathwork classes out of our brick location for all of our clients, and a very, very low cost to guests and friends of Monmouth Integrative Counseling Services. In addition to that, we are also hiring therapists who specialize in trauma modalities such as EMDR, DBT, and we are searching for a nutritionist and an eating disorder specialist to also address other areas of mental health functioning.
That's so important. So you mentioned you have a brick office. Is that your only location? Tell us about that.
So thanks for asking. We have two locations at this time. Our first location, which opened in 2019, is out of Manasquan. And then we also have our second location at this time, which opened in 2021, out of Brick. We are anticipating in 2026, moving a little further north, probably in the Tinton Falls area. That's our expectation and hope.
So much growth for you. And you talk about these different modalities that your therapists use to treat different situations and conditions. You seem to work with a large span, many different age groups, right? So go over a little bit about some of those modalities you mentioned. You mentioned EMDR. You go ahead. Tell us what you've got.
Thank you. Sure, you got it. EMDR is a trauma-focused modality that helps essentially the brain reset from a traumatic event. Oftentimes, when we have a traumatic event or memory, our feelings and our thoughts attach very closely to that. So it feels like there's only one path of facilitating how we respond to that event. Through EMDR, we're actually working to reset the brain so that eventually we get to a point in our healing and our journey where we can have memories of a traumatic event and understand that although those events may have happened, they do not need to affect us in this present moment as they did before. We can move on from a survival kind of mindset to a thriving mindset through the EMDR.
And this is not just based on intuition or something that you assume to be effective.
I
This
wish.
is evidence-based and has
Absolutely.
studies behind it. And there's a specific method that your therapists need to be trained in to
Yes.
deliver this service.
Yes. So thank you for also mentioning that. That is absolutely correct. This is a specialized training, a specialized modality, widely used now. Used to be sort of less popular, but I don't know, maybe more recognition or acknowledgement of trauma coming to the forefront of mental health over the past few years has motivated others to start focusing on a trauma approach to mental health and to treatment. Absolutely. Yes,
So, beyond trauma, and I know that trauma is an enormous issue at this point,
absolutely.
what are some of the other reasons that people might seek out to talk to a therapist and something
Sure.
that you can help people with as far as a symptom or something that they're struggling with?
Sure. I mean, if you think about it, essentially the question is, what is mental health? So, mental health essentially is, at its core, it is our emotional, physical, and psychological connection to the self, emotionally, physically, and psychologically, but also our connection to others, our connection to our environment, and our connection to the world at large. And when you are assessing your connection to all these variables, that is where we can say, if it's not a healthy connection, if you're struggling, if you have anxiety or depression about any of these connections, we would encourage you to go talk to somebody about that.
Okay. And I know that now, especially, probably what seems like more than ever, young people, teenagers are having a really hard time adapting to certain situations. How do you approach a relationship with a young person who comes to you for help?
Sure. Again, I love that you're focusing on the kids, on the younger adults. In the state of New Jersey, 1 in 5 adults reports a mental health issue. 1 in 5, which, according to our numbers, that equals about 1.4 million people. In the state of New Jersey, for ages 12 to 17, it's 1 in 6. So the numbers aren't that far off for kids who are suffering with anxiety, depression, the effects of overusing devices, cyberbullying, relationship issues. There are a multitude of stressors that can bring an adolescent or a child in for treatment. And we support that. The numbers are staggering in our state right now as to kids who need help.
Absolutely. And I know that the therapists that you work with, they're all absolutely quite qualified and extensively trained, but some of you have different focuses than others. I know that grief counseling is part of your background and
Yes,
what you provide. So, talk a little bit about how to approach that.
sure. And you're right. My purview, I guess, would be considered grief counseling and trauma work. We have multiple therapists who are trained in something called Dialectical Behavioral Therapy, which is most often referred to as DBT, evidence-based research modality that is geared toward adolescence, right? Adolescence is a time of impulsive behaviors, quick decision makings. Things happen very quickly when you're a kid. DBT is a framework that helps slow that down. It's a framework that helps kids understand a very important concept that two opposing feelings or facts can be true in the very same moment, right? So for example, I can be angry at my parents and I can also know that I love them. I can understand that the rule needs to be there and it feels very unfair right now in this moment. Need to help kids understand that this is a very important concept, right? This dialectical approach to relationships and life in general.
So, knowing these kinds of frameworks and then having the ability to bring the physical into the healing process with yoga and breath work and sound bowls, that's really embracing the integrative part of what you're doing, right?
Absolutely. So, I see 25, 30 clients a week, and I can say that in any given week, 60% of my clients, we do 5 minutes of breath work, 10 minutes of breath work. But I often wonder, how often are we practicing this breath work out of session, right? The classes are geared toward showing up to make a commitment to the somatic experiencing, meaning reconnecting to your body in the present moment through the breath. That to me is the number one skill to get through anything that life is going to throw at us. Breathe. And when we can practice breathing on a regular basis, knowing that it's part of your integrative approach to your mental health and healing at Monmouth Integrative, I think that's where true connection and progress and healing are going to happen.
Trish, we need to put that on a t-shirt. Breathe.
Breathe.
Just breathe.
Just breathe. That's it, right? There's,
I
yeah,
love
yes.
it.
Breathing is the number one survival skill right now, I think. So, yes.
That's fantastic. So tell me how all of this started for you. Did you want to do this from when you were very
Yeah.
young? And how did you transition into becoming a business owner?
Geez. Well, kind of a personal story here.
Okay.
When I was 13, I was very depressed and anxious, and I did attempt suicide. So I think I knew from that moment of survival that I wanted to go out and help people. Through decades of working on myself, my own therapy, and just knowing that mental health is so important, I knew I had a mission from that day of surviving my suicide attempt, that mental health would be the only path for me.
Thank goodness you're still here.
Thank you. Thank you.
And how many people you've helped since. All those people.
You know, I don't know how many we've helped. I know if we can help one, we did a good thing.
Absolutely.
Thank you.
Wow. So so let me ask you this.
Sure.
Thank you for sharing that with us. That is amazing. And what do you hear from your clients back to you? What do they love about working with you?
Mm.
Have they expressed to you how you've been able to help them?
You know, I think the one thing I do hear most from my clients, so if they're listening, I hope they agree, is that we do authentic work, right? We show up and some days it's not pretty. Some days it feels like, as I would say, we are just slathered in split pea soup and it is not pretty. But that's the work of authenticity. That's what we strive for in our healing, is to be authentic. And as someone who knows what authenticity really does mean, to say your story with courage and vulnerability. That's really where the work is. And I would say that most of my clients would identify with knowing that this is authentic work, right? It's not always pretty. We don't always leave session feeling wonderful, although that would be great if we did, but we don't, but we keep showing up. I often say to my clients, sometimes the most courageous thing we do is open our eyes and put our feet on the ground and go, right? Some days that's hard to do, and knowing that we can just do that, that's progress and that's success. That's healing.
Fantastic. So, you had mentioned earlier that medication management is one of the services that you provide. Is that something where you can identify an issue with a patient or a client and make a recommendation about how to move forward?
Well, I guess that's a yes and no question. So,
Okay.
as the clinician, if we notice that the clients are not improving on any level or, getting worse, so not being able to get out of bed, panic, anxiety are still so prevalent in almost all areas of functioning, not eating, not sleeping, missing work, not able to engage in social relationships, we may have a conversation where we suggest, let's talk to the prescriber. This is just a conversation. A prescriber, someone who might be able to recommend a medication to help you. Sometimes the prescriber might say, you don't need a medication. Stick with therapy and let's reassess in 30 days or 60 days. But sometimes that recommendation is there to get us to that next set of functioning, right? So that we can get out of bed, so that we can eat again, so that we can start going for 5-minute walks to feel better. And then we can reassess. So it isn't something that we control the medication, but we can make that recommendation just for that conversation to a prescriber, which at Monmouth Integrative, we have prescribers on staff. Oftentimes, what happens is we have a discussion, a client and I will discuss maybe needing medication, just going to talk to a prescriber, and then that follow-up gets lost in the sauce, and I don't know what the prescriber recommended. I don't know what the follow-up is. I don't know what happened, right? But when we keep that in-house, we can consult, we can create more of a treatment team approach. And through that treatment team, the client is in charge, the prescriber's on board, the therapist is on board, and then usually we have a yoga instructor on board, someone else who's also helping cultivate that sense of healing and calmness, and again, breathing.
Okay. So, is there an area of your practice that you're excited to grow? You were talking about potentially opening up another location soon. Tell us about what's in store for Monmouth Integrative.
Wow. So, what's in store is we are planning on making each office its own little village, I guess, of mental health services. So, every office moving forward will have a wellness room. It will offer yoga, breath work, sound bowls. Every office will have a prescriber available. Every office will have therapists available to address adolescents all the way through older adults. We want this to create a one stop shopping perspective. So that's really what I'm excited about. We're also going to be enhancing and growing our kids' programs. We need to help the kids, whether it's how to effectively raise your kid with a cell phone, how to address cyberbullying, how to address healthy relationships, how to address suicidal ideations, how to address anxiety and depression. We need to start helping the kids more. I think that we are missing out on valuable time to be addressing mental health needs of our children.
Couldn't agree more. It's so important and so prevalent now.
Yep.
Beyond your physical locations, I wanted to make sure that folks know about the fact that telehealth within the state
Good
is
point.
also an option for you. Talk a little bit about what people can expect with a telehealth appointment and the kinds of situations that make sense to address over a telehealth.
Sure. And I think that's a great point to make that COVID, there might have been one or two positives that came out of COVID, and one of them is telehealth. Prior to COVID, telehealth was kind of poo pooed and very, very rarely ever approved for insurance reimbursement. So after COVID, telehealth became pretty much a staple for all areas of seeking treatment, right? You can go to the doctor now for your primary care for telehealth, your cardiologist, and mental health as well. So
So
we
important for especially for homebound people.
absolutely homebound people, people with anxiety, right? During COVID, we had plenty of people who were saying, I've been waiting for this to happen. I've been waiting to just talk to somebody over the computer. So people with severe anxiety, with panic, severe depression, who are struggling just to get out of bed, we find that telehealth has actually enhanced our show rate, meaning we have more people showing for appointments than before telehealth. So this is a wonderful addition to providing services. So at Monmouth Integrative Counseling Services, we use a HIPAA compliant platform, meaning that it's encrypted. It's not anything that can be compromised. So your privacy, just like sitting in an office, is just as secure as on the computer because we use an encrypted HIPAA compliant platform.
Well, that's so important to know. And
Yes.
for your clients or your patients, do they need a computer in order to attend a telehealth appointment, or can they do it with a tablet or a mobile device?
You could do it right on your phone. If you just have a phone, that's a smartphone. You can do it right on your phone. You can do it with a tablet. You can do it with a laptop. And look, some people don't have any of those. You can just talk on the phone. Phone is actually also an approved form of communication now since COVID to allow for mental
Wow,
health.
that's fantastic. So, Trish, you live and work at the Jersey Shore in the Jersey Shore
Georgia.
area, right?
Yes.
Okay,
Yes.
so when you're not working and
Oh,
providing these essential, super important services for your clients and your patients,
yes.
what do you like to
Oh
do
my
here
goodness.
in the Monmouth Ocean County area?
Well, we love to do a lot of things, but I would say with summer still lingering, we love to go to the beach. We love the beach. We love Jenkinson's. We love walking the Spring Lake Boardwalk. We love going to Avon and just sitting on that beach, watching the waves. This summer, between the beautiful landscape of the Jersey Shore and the wonderful weather and all the people who are coming down just to enjoy that one day in the sunshine, I think that really is our favorite thing to do at the shore.
That's terrific. Who doesn't love it?
Who
Being
doesn't, right?
Yeah.
Yes.
Agreed. So I know that you like to participate in community events and that you really support some local women run organizations and some nonprofits too. Tell us about how
Oh my
you
goodness.
enjoy giving back and drawing attention to some of those organizations with Monmouth Integrative.
Sure. Well, right now we have partnered with nonprofit Every Stitch Counts. We are collecting dish soap to help out families in need of.
I'm very familiar with Debbie Trainer. She
Yes,
is the
Debbie
head
Trainer.
of
That's
Each
right.
Stitch
Yes.
Count. She donates dish soap and handmade dishcloths to
Yes.
local food bank.
Yeah.
Absolutely. And it's so important because when people are struggling financially, one of the first things that kind of suffers and they go without is soap and hygiene. The fact that she's able to provide these for food banks, it's a product that they don't see a whole lot of.
Yes.
And the as soon as she brings them in, they go very quickly, but it's much needed. So
Yes.
your support of that organization is incredible. We will provide a link to her in the
Wonderful.
note.
We're also starting our annual food drive. So, our food drive begins at both offices, October 20th through November 14th. And in lieu of payment for friends of Monmouth Integrative Counseling who take any of our wellness groups, if they make a donation to one of our food bins, they can attend any sort of wellness class for free with the donation instead of paying for the class. So we are accepting donations that way. October 16th, very important cause, is Intimate Partner Violence and Healthy Relationship Awareness Day. We are supporting that cause through fundraising that day, cash donations, and we are wearing purple and promoting throughout on social media and the website awareness of this very important cause.
That's wonderful. So
Thank you.
you mentioned that you have wellness groups and wellness classes. That's not something that we talked about, so please describe what you mean by those.
Absolutely. Thank you. Thank you for reminding me. Right now, we have our adolescent DBT skills group run by Jenna Roma, LSW, and DBT certified. That class is Wednesday evenings. It's an 8-week program, rolling admissions, meaning even if you're a couple weeks behind, we just add those other modules at the end of the program. And we're also preparing for our next grief recovery skills group that I run. That will also be out of the Brick office. And we are preparing in the spring our nutrition classes, as well as the parents, some sort of parent awareness, cyberbullying. Are you sure you want to give your kid a device yet? Educational series, 3-part series. We're putting that together right now. So we're in the works with a couple things, and these are the groups we have right now, our wellness groups.
And these wellness groups are, as you said, in-person
In
classes.
person, in person right now, yes. Free of charge. We just want to help educate and support the community.
I love that. So, if anyone is interested in joining these groups or learning more about them, they can get in touch. But
That's it.
what's the best way for people to get in touch with you?
I grew up with a landline. You can always call the office, as well as check out our website.
Yes, we will put the website link in the notes.
Thank you.
Um,
Okay, the number to call, that old good old-fashioned landline, is 732-231-5170. Lindsay and Brianna work the phones, they work the front desk, they will help you. They are wonderful, supportive, professional, and they will listen to whatever it is that's bringing you to treatment to help.
I love that. So, is there anything else you want to share that we haven't gone over at this point?
No, just that I think you're amazing. Thank you so much for having me today. I love supporting businesses, local businesses at the Jersey Shore. What prompted me to become a business owner? I wish I did know the truth to that. I don't know. I just thought maybe the more the merrier. I just decided that we need to start growing mental health awareness, normalize the need for treatment, and asking for help is okay. And so I think that really was my motivation behind starting my business.
And you can tell by your growth and success that that message is definitely getting through to the folks
Thank
that
you.
you've been working with. So, congratulations. I'm
Thank you. I
happy
really
that
do
you
appreciate that.
came and you were a guest today.
Thank you so
Thank you
much for
for
having
joining
me.
me.
I
Good.
appreciate your time today. So thank you so much. Thank you.
And is everybody ready for our giveaway? You could win a free gift card to Spire Coffee House in Toms River. So, do you have a question in mind, Trish? Do you want to ask a detail about what we spoke about?
Oh boy.
I've got one.
You take it. You take it. Go ahead.
Okay, sounds good. Yes. So Trish spoke about the fact that she has more than one location, but which was her first location? What town was her first office
Oh,
in
that's good.
for
Very
Monmouth
good.
Integrative Counseling Services? You can email your answer to me at lisa@shopjerseyshore.com. Put Monmouth Integrative Counseling Services in the subject line, and we will choose a winner before the next episode. And that's all the time we have for today. Go ahead.
One last thing. I did want to say thank you so much for having me on today. Today is October 10th, which is World Mental Health Day. So thank you so much for bringing awareness to mental health and to allowing today be the day that you and I meet and discuss this. So thank you so much. Thank you.
I'm so glad. Okay, we're definitely going to put out an announcement today, but you'll
Wonderful.
be able to see the full episode. Everyone will be able to see the full episode on Tuesday, and we'll see you then. Thank you for joining us.
Thank you,
We'll
Lisa.
see
Thank
you
you
next
so much.
week. Okay, and Shop Jersey Shore. You are welcome, Trish. Have a great day.
You too.